want to do that, you know, as far as like with your gloves. So when you do your gloves like that, that's kind of like how I do, especially if they have really hard veins. Okay. Choose your vein. First of all, you want to assess the patient, what type they are, how old they are. Ask the patient about the veins. We get a lot of repeaters that know their veins, and they'll say, oh, my veins roll, or oh, my veins hide, or they collapse. So ask them, you know, what your veins like. And they'll tell you. And what you want to do is always assess both sides of the arms to see which one. Now, if you're in a hurry and there's nothing there except for this big happy one, we want to save these for lab, because this is the ones that labs like to attack. And a lot of times if they have a lot of blood draws or a lot of IV sticks in the past, you're going to have a lot of scar tissue here. So just what you're going to do is you're going to assess the veins, and then you're going to assess what you're going to be putting in the vein. All right, if they're a hard stick and you can't get nothing but a little baby 24, okay, then go for it. And I tell my newbies who's starting IVs, start with the small ones unless they're having a ton of stuff going through the vein, such as blood. You can actually do blood through a 22 at a lower rate, but we don't like that. We like to actually use 18 and 20s. Now, if you will remember, the lower the number, the higher the gauge, okay? So this is the ones that we use for our blood. And if they're getting a lot of IV medications, such as your high caustic medications, such as vinegar and morphine, your dopamines, your vasopressors to keep your blood pressure up, okay? So today, we're actually going to start off with the 24s, and these have to go back to stores, unfortunately. When I was talking about hubcap and the cap, that's this little hub thing that when they say, okay, stop the IV fluid and NS lock it. So you want to go ahead and NS lock it with this hub and some NS. All right, so what you're going to do is you're going to set the vein first. You're going to choose this. Remember, all of these are chargeable items. You don't have to stick the sticker on there. And so I'm going to show you guys that this is what you put to connect to this. Today, we're not going to do that. We're just going to stick and then pull out. Okay? So you're going to have your gloves. I got mediums. And you want to go ahead, before you put on your gloves, is get all of your IV stuff together. Now, we had an RN that was so cute. She did her stick very fine and dandy in ER, but guess what? She wasn't set up and she wasn't prepared, and blood went all over the place on her. So I always like to use these pads underneath them or a towel. So you're going to open that up for your to discontinue it, and then you're going to open this up and get everything set up. Isn't this fun? Mm-hmm.
Now, the one thing that I have a question about is the depth.
Yes.
How far you stick, because the one thing I fear most is going through to the
and
other side.
And I've seen that happen, and I've done it too before. You'll find your own technique, but I'm going to show you guys on this one. I guess I'll take this one. I'll show you guys on this one on how I do my technique. When you take this off, you always inspect, because there can be faulties, and I have them a lot in the 24s, like there's frayed catheter tubings and stuff. So you have your bevel right here that bevels up just like you do your sub-Qs and your IM needles. So I always inspect it a little bit, and I do a little twist to break the seal right there. I kind of do that little twist. A lot of my RNs, I was seeing him do this. Okay, I'm ready. You know? Okay, well, that's really cool. But one, you're doing something wrong here. You're covering this little clicker. If you're up here and you're shaken or you're nervous or you're in a, and you accidentally push that, what is it going to do? This little button right here retracts the needle. So I do it like a dainty. Okay, so when I'm doing it, okay, I find my vein, and always you have to be comfortable. If you're not comfortable and you're not sitting on the bed and you've got a good, grab a chair and you're sitting like this and and you're, first of all, you have bad back. Okay, so when you're thinking deep, because this is your deeper veins right here, and then this they'll teach you this is your superficial. These hurt, and these hurt a little bit more like right in through this zone area. But I'm a deep girl, so I like this one. I like this one. Always ask them if they're right or left. That's a big one too. But when you're doing a deep one, yeah, you want to go a little bit more on a higher, like a higher, and get in. And once you get in, then you level your bevel. That's what I call it. If it's you're talking about a very superficial one, you're not going to be doing this. You're going to be kind of grabbing a hole here, hold on to your 3 fingers right here, make your little dainty, hub, and then you're going to stick, you're going to go like about that angle. Poke. Now, don't hesitate. If you're going to sit there and go, ooh, 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 you're going to go big poke. You're going to tell those patients, this is going to be a big poke, and so you do a quick jab. Once you get into that jab, then they're okay. Okay? So that's kind of like how you do on your angle. Okay? Alrighty, we're ready?
I'm nervous. So is there anything wrong with like me keeping one ungloved hand to feel and then gloving? Or?
No, it's
Okay.
always a good law to
Okay.
have 2 gloves, pop the top if you have to.
Okay.
But always make sure you have everything open because a lot of times you're not going to be having help. So you're going to open up that. You're going to get your tape ready. You're going to open up this and have this all open and ready to go.
It's got a piece end.
And you're going to ask me questions about my veins because I'll tell you how my veins are.
Are your veins rolly?
Okay.
What are they like?
They don't roll.
Okay.
I have wonderful veins,
Okay.
except that they're valvy.
Valvy.
Valvy. I've got a lot of valves on my veins.
Okay.
Tape,
Thank
right?
you.
And what you want to do on your tape is how I like to. Now we don't chevron anymore. Now some people in ER still chevron, but it's a no-no because if you have to change it out, so you want to. I like to thin out my tape and do a thinner one like that, and I like to have this all ready to go like that, and then have it right there. Okay.
All right.
All right, so you have this popped open and closed. You have that open.
I don't know what any of this is. You have to talk me through.
This is your upside.
Okay.
This is your tourniquet like
Yeah.
you do blood. You have to squeeze that out because this is your alcohol prep.
Okay.
I always bring 2 things in with me at all times. So if I'm starting an IV, I bring 2 in. I always bring 2 kits. I always bring extra alcohol. So you're going to pop that open.
How do I do that?
You just squeeze it just like
okay.
like somebody passes out and you want to give them that.
Okay.
So you want to do that.
Oh, it's leaking.
Yeah, that's okay.
That's right.
You want to open that up and have everything ready that way.
Okay.
Okay. Now you're going to tighten that up on the tourniquet. You know how to tourniquet tight?
Nope.
Okay. This is how you do it. Okay, if the vein is down here, don't go way up here.
Okay.
Do it about 2 inches, about 1 fist. Okay? So if I'm wanting that vein right there, I'm going to go right there. You
Okay.
pull up, you go down, you lift it up, and you bring it around.
Okay.
Okay?
Sounds good.
All right.
So should I pick the vein before I tourniquet you?
Yeah, usually.
I was gonna say this looks big and honker. Like that seems like it would be the easiest.
Might. Sometimes easy isn't always.
Yeah.
Yeah. Go ahead and tourniquet me and take a look.
Oh, lovely.
Very good.
Hi, finger.
Up. Tight. Tighter.
Really?
Use your fingers down here.
Oh,
like
okay.
down in. Uh-huh. There
like
you go.
that.
Yeah, close to the.
Is that
That
good?
a girl. Yes.
Okay.
Very good.
Wow.
Now, what I
that
tell
really
my
makes
people,
them go.
now what I tell my people is, if you have people that have hard to find veins,
Uh-huh.
close your eyes. Close your eyes and feel them. I want you to take your finger and feel that vein.
Oh wow.
Okay, now I want you to take your finger and feel that vein. And my patients go, she is freaking closing her eyes. I was like, okay, now if you feel that one, what are you feeling there with your eyes closed? What are you feeling?
It's big and squishy.
But do you feel valves?
I don't know what those feel like.
Little bumps.
Yes, I do.
Okay, that's not a good one.
Okay.
Can I feel it while she...
Everybody can feel it.
Oh.
Okay, that's a valvy one. If you get in there, you're going to get in, but you're going to have valves and you
Yeah.
won't be able to thread.
Yeah.
So it may be a good one, but it's valvy, right?
Yeah.
Okay, now look at some straight ones. Okay, is there a valve right there?
Probably.
Yeah.
'Cause there's a
Now
joint.
look at that one. Is